India and the United States stand as two titans on the world stage, and their collaboration extends far beyond politics and economics.
We're teaming up to design and develop new technology that are going to transform.
Today, we delve into the realm of health diplomacy, exploring the deep-rooted partnership that has fostered progress in human development for millions.
I think
in this interview, we'll explore the multifaceted aspects of this healthcare partnership. We'll discuss the triumphs and challenges faced over the years, from tackling infectious diseases like HIV, AIDS and tuberculosis to the ongoing fight against cancer. But this partnership isn't a one-way street. India's vast pool of medical data offers invaluable insights. While the US brings cutting-edge research and technology, we'll delve into how this synergy is propelling progress, focusing on areas like AI-powered cancer diagnosis and cost-effective healthcare solutions.
We're going to see more technological change.
However, the road to a healthier future isn't without its bumps. We'll also address the past trade frictions and explore how the US and India are navigating them to ensure a resilient and mutually beneficial partnership. We have with us US Ambassador to India, Garcetti, and the Health Attaché, Genessa, Georgi. Thank you both for joining us and taking out time for DD India. Appreciate it. Beginning with you, Ambassador Garcetti, we've talked about collaboration between India and United States, particularly in the health sector, for a really long time, and especially when it comes to cancer research. You've concluded the first cancer moonshot dialogue in New Delhi. Tell us about the key areas of focus and which particular areas we could see more work in the coming future.
Well, the excitement was palpable at the gathering between US and Indian professionals who are trying to really do this moonshot, and we called it moonshot. President Biden, just like President Kennedy once said, let's put a human being on the moon, and nobody thought that was possible before we had the technology, the know-how, and showed that human beings, innovative, collaborative, can do almost anything. The same sort of ambition is part of the cancer moonshot, and you know, we've made so many advances in cancer. I mean, just speaking personally, my sister, my father, and my mother 7 times have had cancer and thankfully survived it. They're alive today because we're seeing the medicine advance, we're seeing the treatments advance, and we're seeing not only India wanting to collaborate, but wanting to contribute to those new solutions, whether it's now you can really find people's genes that are marked for greater probability of having cancer, but also you can use their genetic pools, their genetic makeups, to try to have new forms of treatment that activate our natural immune system, for instance, to be able to combat cancers alongside the traditional therapies of surgery, radiation, and chemotherapy. This is an exciting time where a lot of people have hope that our loved ones, ourselves, will be able to survive cancer for many years and sometimes even eliminate cancers between us. But it's an example of the US-India relationship being, as I call it, a multiplicative relationship. It's not India plus the US, it's really India times the US when we tackle these challenges together.
Right, but apart from research, we also talk about the issues of affordability and care and making it accessible to the rural part of the country, and not just in India. We're looking at collaborations between other countries as well, where India and US could do a lot more than just vaccines. So particularly when we talk about cancer, there'll be, in India itself, there'll be more than 1.5 million new cases of cancer by 2025, and that's a significant number. Are there any particular initiatives which would help reduce this burden?
No question. I'll let Genessa go into greater detail, but some of the things that we're doing are early detection. We know the best way to combat cancer is to prevent it or detect it early. We all have, in our own families, we all know people when that diagnosis comes and it's just a matter of weeks and months that people have left. But those cancers can be detected even more and more early, especially in communities that don't have as good access to healthcare. So we're looking at cervical cancer as one of the areas that we want to help with earlier detection, working together with our Indian friends. We want to make sure that women have breast cancer access, and that community health clinics, community health systems can really be well equipped, that it doesn't matter your income, doesn't matter your geography, your language, your religion. Everybody should have that equal access. And then second, we're taking that into third countries as well, training health professionals in places like Fiji, Philippines, going into Africa soon, to look at how we build those health systems for health workers and include cancer as part of that training so that they can do the early detection and empower people to get the right tools they need to stop things before they get bad.
I'll just add, I completely agree. The component on prevention is so important. And so where we do know there are things that we can do to prevent cancer, so reduction of tobacco use or reduction of environmental components, that's where on the globe we want to work together to be able to reduce and prevent cancer from starting. And then screening is so important to be able to detect early before it manifests or it metastasizes into other parts of the body. But you also mentioned the affordability side of cancer, cancer treatments. We are working together, the US and India, on new therapies and retooling therapies to make sure they can be manufactured in cheaper ways, in more affordable ways, that brings the latest of scientific investment and engagement together to be able to address increase access and affordability for cancer treatments globally.
But the partnership between India and US, particularly in healthcare, goes way back to 1960s when it comes to public health.
Yes.
And starting with eradicating smallpox and various other infectious diseases, working on non-communicable diseases as well, and lifestyle diseases particularly. And the recent one that all of us seem to be battling, or not in a sense battling, but looking at very carefully is monkeypox. Is there something that we're working on, especially when it comes to this, and the fact that we have a global detection center here in New Delhi, given the urgency of diseases that we've seen in the past? How are we working on this, if in case we are?
And Mpox was just declared an international public health concern by the World Health Organization, and that really mobilizes additional collaborations, partnerships between not only India and the US, but the rest of the globe. And this is really important in Mpox. As we see, it starts off as a slight fever, it can develop into a rash, and the new clade of Mpox has a little bit more infectiousness, and it has a little bit higher of mortality rate. So this really comes to be an important that we are partnering and looking for where it could spread. One of the partnerships that we do here in India is collaborating with the Emergency Operations Center and Observation Center, as you mentioned, at the Ministry of Health, as they look through different data points to try to see if Mpox or any infectious disease can be reported, detected early, so it can mobilize a response quickly. And I'll pass it over to the ambassador to add more.
We currently have a couple vaccines out there. One that's made in the Netherlands. The United States is involved in trying to ship 50,000 doses of this into Africa, into the DRC, the Democratic Republic of Congo, where the biggest hotspot is. We've seen a couple cases be outside of Africa, one in Europe, one here in Asia, and I think it's absolutely critical to raise that awareness. But the US and India together as the two largest democracies, arguably the two largest health powers in the world, really can do a lot on that detection. But also I look forward to how India can help scale up, and WHO is looking at early approval for any innovative treatments and vaccines of Mpox to be able to see this powerhouse of vaccine manufacturing be part of that fight and ultimately that win against Mpox.
When we talk about the generalized system of preferences, of course, there was a certain, disruption when it comes to the supply chains as well. That seemed to have altered the relationship, and when it comes to India and United States healthcare partnership particularly, because India would not then be able to send roughly around 5.6 billion worth duty-free goods to the United States, which is roughly around 12% of the exports, and it's an important part of the bilateral trade. How are we looking to address this issue, given that this collaboration and the existing supply chains, and given China flexing in the Indo-Pacific, how important do you think it would be to include India in the GSP and perhaps strengthen that relationship and erase those trade barriers in the future?
Personally, I think it's incredibly important. The fewer barriers we have, whether it's in health, whether it's in defense, whether it's critical technologies like climate and energy solutions, the fewer barriers that we have between the United States and India when it comes to this innovation, co-production, co-development, the better it is not only for our people, but I believe for the world. So it is the stated objective of the Biden administration and hopefully future administrations, we have a presidential election, to continue the work to see if we can bring GSP preferences back for India and a number of countries. That will require movement on Capitol Hill, but our United States Trade Representative visited here recently, met with Commerce Secretary Goyal, and said that she had some optimism that for the first time in some years, of course it's not in a vacuum, these get withdrawn. There's often asks to make sure that barriers here and other equal trade should be on both sides of the Indo-Pacific, but we're so aligned. There's no reason for us to be putting up more barriers. In my opinion, we still have too many barriers. We should be bringing those down, and when it comes to medical equipment, when it comes to being able to have pharmaceuticals and the standards on both sides of the Indo-Pacific, we can only benefit from that being freer, easier, and fairer. So I'm optimistic that this next year, that this is something that the United States Congress will take a close look at, no matter who the president is, and I hope that the logic that certainly I share, that maybe the question you asked shared, will prevail.
Genessa, when we talk about the new initiative, which is about Women's Health and Livelihood Alliance, it is a great initiative, but when we're talking about sexual and reproductive health, it has become an important focus in India. What is it that exactly that you plan to do?
Wonderful. This is a USAID project on improving women and their livelihoods and opportunity to be able to make choices around reproductive health. It's an important collaboration between USAID and India to be able to encourage and support women and their families.
You know, I was in Nagaland last November and saw some of that kind of really on the ground work that the US and India do together. Sometimes it may be that we have development programs that are replicable at the village level. For instance, helping to fund folks when it came to HIV/AIDS, and many women in Nagaland are affected by that, who have bikes that can go from village to village to make sure that people are taking their medicine. And then it kind of is able to be adopted by the state government, the central government, and replicate itself from there. Other times we're learning things from India, where we're seeing on the ground level a really robust public health system that we don't have necessarily neighbor to neighbor, and that we take that back. And other times it's with a third country. As I mentioned before, we had Fiji sent its largest group of medical professionals ever outside of the country to come here to learn about telemedicine from Indian professionals, funded by USAID and the Ministry of External Affairs, in what was a really historic collaboration. I think we learned some things from them too, because you always listen and learn, not just teach and preach. But many of them who had family connections back to India as migrants to Fiji generations ago, are going to remote parts of those islands. And it's an example of how we don't just do this for ourselves or for our bilateral relation. I think what brings India and the US together in so many areas is that we do believe in giving something to the world, and when we're doing it together, it's even more powerful.
Yeah, and I'll just add on to that, on the maternal health. Part of the US-India health dialogue, one of the focused areas was on maternal and child health. And so many of the things are things that the US can learn from India on how they're reaching out to additional communities, how community healthcare workers are reaching into every home and increasing access and doing it affordably. And so this really is a bilateral partnership where we are learning from each other, doing exchange visits, doing joint research, joint collaborations, where we can globally benefit from these partnerships.
You've worked with very closely with the Indian health agencies as well as the Ministry of Family Health and Welfare. Mm-hmm. You've been part of various programs. Tell us about the key areas of focus and where you see challenges perhaps in implementing some really ambitious programs, if I may say so.
Yeah, as you highlighted, the relationship between the US and India on health is over 60 years. It is really built on that mutual respect, understanding, scientist to scientist, researcher to researcher, public health official to public health official, where we can share open and honest about the challenges, that each government that each community faces, because they are global health challenges. And so we're able to work together over this long partnership through smallpox eradication, through elimination of polio in India, to the challenges of reducing cases of HIV and tuberculosis and malaria, to even the non-communicable diseases. So as we're working on cancer together and diabetes, there really are opportunities where we can learn from India, and India can share with us and share with the rest of the world.
Would you see any particular area where you think we could prioritize or maybe expedite?
Yeah, I think on both the US and India and the globe, a focus on prevention. It is much cheaper to focus to prevent a disease than it is to be able to treat it. So collectively, if we can work on prevention together, using every tool and opportunity that we have to be able to address comprehensive prevention, stopping them any diseases before they come, it really helps both our countries and the globe.
What lessons have been learned ever since the pandemic for the future, especially when we talk about infectious diseases and communicable diseases? A lot of research and work that needs to be done, I'm sure, is already being done. Then how more prepared should we be to help countries and allies? During the pandemic, India sent HCQs to the United States, whereas the US sent raw material for India's vaccines and collaborated with hundreds of companies to mass produce vaccines back then. But that also taught a lesson on how to be better prepared as allies and enhance the existing infrastructure.
That's right.
So how are we going about that?
I think we all learned none of us were prepared enough. I was a local political leader in America as mayor of Los Angeles at the time. And I learned, lessons that I think apply both sides of the Indo-Pacific. I called them the 4 8s. And I don't mean the number 8. I mean, first, accelerate. Second, innovate. Third, collaborate. And fourth, communicate. I think we learned that you can't act quickly enough. When lives are on the line, it's better to try something that day. You can correct it tomorrow, but don't wait until everybody says this is the perfect answer. Because when people are dying and infection is spreading, action has to be taken quickly. Second, innovate. The way we do things, it may be that we have solutions or we have ideas, but we had to bring in so many people across society, here in India, in America, who never really thought of themselves as healthcare workers. For instance, firefighters in my city became folks who were giving out tests initially when we finally had tests to see whether people had COVID. Later on, we were asking citizen volunteers to come forward to help vaccination clinics who had never worked in healthcare before. So innovation was really important. But third, and where US and India really connected, was on collaboration. Don't do these things in a vacuum. Whether it's information, I remember being the head of a group of mayors around the world, 100 largest city mayors, and we were having the mayor of Seoul, Korea tell us what drive-through testing was when nobody knew what a drive-through test meant. The mayor of, in northern Italy, in Milan, where the biggest hotspot was at the time, saying this is how you can get your hospital beds ready so that fewer people will die in the hallways. And the next day, we were using that and spreading it quickly. The collaboration between the US and India was historic. We got to know each other, our health professionals worked together, the needs that we had, the strengths that each one of us had came together. So as you said, India aided us, and there are Americans alive today because of India's assistance to the US, and vice versa. When India asked, we were able to send aid that Indians today are walking the streets of Delhi and other places because of that assistance. I think the last thing, though, is communicate. When bad things happen, it's the human instinct to cut off, especially if you're in political or administrative leadership. You don't want to talk much because you're worried you might get blamed. When people need the exact opposite. They need constant communication through the media, through neighborhood levels, through apps and technology when we're isolated. And I think we're much better prepared today to communicate with each other. You asked about MPOX, about how we can share worldwide information much more quickly, medical solutions much more quickly. And I would say the last one is we have to also look at those laws and regulations that sometimes put profit above people and see what we can do when we do have solutions to get those ramped up as quickly as possible. And I think there's plenty of light you can shine all over. It's not one country's issue. It's not just the West versus the South. It's something that all of us should do in moments of emergency. I think we learned the lesson. A solution is a solution. Let's figure out how to pay for it after we save lives.
Looking at the health collaborations, and since US, apart from its assistance in the last, I think, 2 decades, has spent half of it on healthcare, if I'm not wrong. What are the challenges that you see on ground? It's been a year for you in India. What are the challenges that you see, and how do you think the two countries can overcome those challenges?
Well, India's in this beautiful, remarkable, and intense place where it's going from a lower income country to a middle and one day, hopefully wealthy country. When those transitions occur, there's disruption. People are moving sometimes from the countryside to the city. Cities are exploding in population. It's the most populous country in the world now. And you see in India that really is taking its place in the world. no longer as a back office, but a front office for intellectual property in the healthcare area, making more pharmaceuticals, for the United States and the generics than almost anybody else, being able to produce most of the world's vaccines. I mean, these are incredible things that I think, post-independence, Indian leaders would be amazed to look at 77 years later. But I also think that we have to play on the strengths that we all have. Artificial intelligence is changing health for the future, and we're investing in local Indian AI organizations that are doing things like helping you cough into your phone in a rural area and get an early diagnosis on tuberculosis to see whether you should get further screened. We're looking at examples in India of a healthcare system that we need in the United States, which is often only in hospitals or remote from where people live instead of being block by block in the communities where actual Americans are. And I think the most exciting place, as I said, is really how we're taking these lessons and not just sharing them selfishly with each other, but sharing them with the world, because the world does look to India. The global South sees India as a great leader. We saw this in the G20. The whole world, and certainly the developed world, often looks to the United States. Neither of us are perfect, neither of us have all the answers, but we can open doors for each other that sometimes we can't always open up ourselves. And so as I look at the future in health, whether it's looking at environmental health, air quality in Indian cities, whether it's looking at things like lead poisoning, water, these are things that we've either gone through or share with you too. The communicable diseases are the things that get the headlines. But it's really, how do we have healthier countries? How do we have healthier communities? And how do we have healthier citizens? To me, if we leave that legacy behind, then the incredible year plus that I've been here will have been time well spent. And like I said, you never can claim credit for the people you keep alive. You can only count those we lose. But I know there will be Americans and Indians alive because of this work who will fulfill their promise, because the U.S.-India health partnership is moving forward.
On that note, thank you, Ambassador Garcetti and Genessa Georgi, for joining us this evening and taking out time. Thank you. Appreciate it.
Thank you so much.